Welcome to our presentation. In today's session, we will be looking onto the prerequisites of healthcare professionals. Before moving to the prerequisites, let's have a look onto what person-centered care is. According to McCourt and McCain, 2017, person-centered care is an approach to practice where a healthy relationship between all the healthcare providers, service users is established. The World Health Organization suggests that there are a range of issues to be addressed in order to make healthcare system more people-centered care. Empowering and engaging people, strengthening governance and accountability, reorientating care models towards efficiency and effectiveness, coordinating services around the needs of people, healthcare providers, interrogation and effective networks, creating an enabling environment for change. Why is person-centered care important? It increases patient satisfaction, reduces complaints against healthcare professions, and leads to fewer malfunctioned lawsuits. And also, it is important for the development of patient capability. The prerequisites focus on the characteristics of healthcare professionals and are considered the foundation of the development and deliverance of person-centered care. Such characteristics are professionally competent, developed interpersonal skills, commitment to the job, clarifying beliefs and values, and knowing self. Professionally competent. Each of these attributes are considered of equal importance. However, the combination of these attributes reflects a health professional who demonstrates person-centered care. Being competent is more than undertaking the task, as it is about being reflective. This means encompassing different skills, attitudes, and knowledge that is associated with holistic care. Holistic care places an emphasis on combining certain attributes of individuals and their ability to perform in situations while also incorporating professional judgment. This means having the knowledge from education, experience from life and work, and having the ability to use both experience and knowledge. Competency can be demonstrated by meeting the standards and principles within profession. In nursing, this incorporates the Nursing and Midwifery Board of Australia, namely Standard 3 of the Standards of Practice for Nurses. This includes 3.1, where nurses consider and respond in a timely manner to the health and well-being of others. 3.3, using a lifelong learning approach to continue professional development. And 3.7, identifies and promotes the essential role of nursing practice to influence greater health outcomes for patients. Developed interpersonal skills. The ability of healthcare professionals to communicate at different levels using both verbal and nonverbal communication, which displays concern for the patient's situation and the commitment to finding solutions. Person-centeredness is made up of positive relationships and is reliant on strong interpersonal skills. Successful communication needs a blend of effective verbal and nonverbal communication skills. Teamwork is an important aspect of interpersonal skills as it allows for the common goal of making sure the patient receives high-quality care. This occurs by professionals having respect, mutual understanding, and good communication. Commitment to the job. Displayed dedication of team members and individuals to the patient and their families or communities through communication that emphasizes the delivery of holistic evidence-informed care. One example of being committed is through organization. Being organized lowers levels of intent to leave, increases retention of information, attendance, and the productivity within the workplace. Clarity of beliefs and values is the recognition of the impacts on beliefs and values from care given by health professionals and the commitment of establishing the full effect of person-centered careness. Clarifying the beliefs and values of practitioners as part of prerequisites of the person-centered framework allows for better health outcomes in the care environment. According to Manley 2004, values determine what people think ought to be done, whereas beliefs are what people think to be true or not. Both values and beliefs are interrelated as it is hard to separate values from their believed effect. The ideal situation for a practitioner is to create and agree on a list of professional values that are commonly shared and practiced in everyday life. This can be challenged when values of other team members do not correlate. Knowing self. Knowing self is a way that a person makes sense of themselves through reflection, self awareness, and engagement with others to become a person centered practitioner. In the context of person centered care, this means recognizing how an individual views themselves and the world, which influences the professional relationship with patients. As we have discussed the prerequisites of healthcare professionals, I am now curious to know what all leadership challenges we will face in the healthcare setting.
Well, good question. It is an unrealistic thought that good leaders are full of enthusiasm and energy. A leader often has to face difficulties in organizing their team. For a health professional to be professionally competent, he or she should be an active listener. As health professionals, we have to do health assessment interviews very often, and active listening is a way to understand all the aspects of communication, to build a rapport and trust with the patient.
I can understand that. I have heard some of the healthcare professionals find it really hard to treat patients different from their own cultural background. What is your comment on that?
Yes, this happens at times. In order to understand the vast difference and diversity, we should have a clear idea of how our cultural background and heritage influence our beliefs, values, and attitudes, because this can indeed influence the way you talk to people you see different from yourself. This is where cultural safety plays its role, which basically means that a person should be provided with care and treatment according to their individual needs, which includes respecting their culture and ethnic background, values, beliefs, and so on. According to Rabsden, cultural safety develops a holistic approach towards person-centered care by taking all the aspects of that person into consideration.
Being in a healthcare system and working as a team, it is obvious that different individuals will have varying values and beliefs. How do you deal with that?
Oh yes, I was getting into that. Conflict is one of the many other leadership challenges that we face. A leader should always recognize that there is a chance of collision of values and beliefs among the health professionals and should take up necessary plans for it. Effective communication with your teammates is always a helpful option for conflict resolution. It is about getting to know more people and their goals. It is also vital to let others express their feelings so that you can create a bond of trust with them.
Practice innovation in healthcare system allows the progression of person-centered care. One good example of this is a story by Jenny Kendall, namely A Comfortable Cover-Up. From her knowledge and experience from the workplace as well as meeting the standards and principles of her profession, she demonstrated the idea of being professionally competent, which is essentially providing person-centered care. Jenny enacted this by recognizing that a change was necessary in hospital gowns for Maori and Pacific Islanders people. This is because she had observed that patients were feeling discomfort before going to the operation theater because of the open back nightly and the pants, which were one size fits all. Traditionally, Maori and Pacific Islanders cover their legs, hence wearing an open back nightly is culturally insensitive for them, therefore does not provide safer environment for these patients. To improve the situation, Jenny visited other hospitals in the Pacific Island where she encountered the use of the lava lava in operating theaters. This allowed those of different cultures to have a more appropriate attire, as it is a wrapped around garment which covers their lower body. This initiated the start of a project where later a formal trial began over 3 months. During this time, surgical patients were offered the use of lava lava along with a blanket to wear in the theater to cover them up. Those involved were pleased with the initiative, and eventually an official launch of this garment took place on September the 22nd, 2008. Now, people from all ethnicities and nationalities are wearing them, as there is a big demand for them in the hospitals within New Zealand and overseas. Through her efforts and competencies as a nurse, she not only displayed person-centered care but also cultural safety by respecting cultures and people and meeting their needs.